Hello everybody, and I want to welcome you to another edition of Engage Now, which is our recorded in-network sessions at MedCity ENGAGE, MedCityNews.com's Patient Engagement and Healthcare Delivery Conference. My name is Chris Seper, and I'm joined by Mandi, Pratt, Chapman. We're going to be talking about patient navigators and really getting the latest updates and insight on what's happening in this important field. We've talked a lot of technology today, but the human touch matters. That's been another theme, and that's one of the things that Mandi's going to talk about here. Quick intro to who you are. Mandi Pratt Chapman is the director of the GW Cancer Institute in the GW School of Medicine and Health Sciences. She has, among other things, helped lead research that led to the publishing of core competencies for oncology patient navigators, and she recently developed a free online training course for patient navigators. Mandi, thank you very much for being part of Engage.
Pleasure to be here.
Well, let's quickly define patient navigators for our discussion.
Sure. So patient navigation is generally about removing barriers to healthcare. So that might take a variety of forms. It might be getting patients or individuals into the healthcare system or through a particular treatment. And my focus is really on oncology patient navigation. So removing those barriers or addressing and mitigating those obstacles to getting screened, getting biopsied, getting treated, and then long-term quality of life.
So I would say this patient navigators seem to remain in some kind of middle ground, right? And highly valuable, but still without their final place in healthcare. A lot of the lay or non-clinical folks seem to be in that area. Can you give us a state of the navigator?
Sure, sure. So I think people have identified that the system is broken, that the healthcare system is pretty difficult to get through, to navigate, and anyone who has a Navigator program knows that navigators are highly valued by patients. Patients certainly appreciate their services, and there are many cutting-edge funders like the Avon Foundation and Komen that consistently have funded patient navigation, and a lot in the breast arena, because a lot of times breast advocacy organizations are leaders, given the bolus behind the energy behind breast cancer survivorship. So, so a lot of these positions are grant funded currently, but increasingly, I think health systems are seeing the value of patient navigation largely due to new accreditation standards and quality standards, satisfaction standards. So I think that as we move in the direction of more value-based care, that they will be increasingly more important for healthcare systems. But right now, yes, they're kind of a mix of grant-funded, operational funding. There's not really a billing code or a way to bill for patient navigation. Unless you're a nurse, there might be certain things that you could bill for.
So they're like an unregulated workforce, essentially roaming within healthcare.
Yeah, so that's a challenge that we're having right now, because navigators are helping to offload some duties that have traditionally been there for social workers or for nurses. And one of the important things about the training that we developed and the core competencies that we developed was to really role delineate. So if you don't have a clinical license, what are those duties that you should be performing? Currently there isn't a regulation of there's no kind of regulation of any kind. There aren't really any standards. So the importance of the competencies were really to conduct a national study with a large number of stakeholders, get national consensus. We had about 525 people complete our survey. We had 23 experts engaged. It was an 18-month process, and really get some consensus around what is the scope of practice, what are the competencies that those without a clinical license that are critical to helping patients through the system should know, should be able to do. And then we built a training responsive to that so that we could push that out for free and make that information as widely available as possible as a foundational course for the people that are doing this day to day.
And can you describe a little bit of the online training? I mean, how long is it? What does it entail? And I mean, do you have to already have some kind of medical background? I mean, can you come from a caregiver who's had a passionate, experience with a loved one who now maybe wants to extend that?
Sure, yeah. It's accessible to anyone, so you don't need to have a medical license. In fact, it's designed for people without a medical license. I think that nurse navigators and social workers could potentially benefit from the training, but it's really geared toward those that don't have a license. You can access it from our website online. You can access it at cancercontroltap.org and just go to the online academy. It will walk you through how to log into the training. You just create a user account with your name and your email address, and then you can log in and access the training. It's about 20 hours. It covers all 45 core competencies. So the content ranges from introduction to the healthcare system, basic information about cancer, ethics, patient interactions, financing minimally. They're not going to be billing specialists at the end of anything, but kind of an overview of all of these key kinds of roles that they play, including interprofessional collaboration and how to work on a team. We really wanted to build this responsive to adult learning theory, so there's interactivity, it's self-paced, so you can start a module and then pause and continue it at whatever point you want to. You can log in and then come back. And there's a certificate of completion you can get at the end. Right now, you currently have 2 attempts to get a successful passing score for each module. And I'm actually working as well with the Academy of Oncology Nurse and Patient Navigators to launch a certification process next year. So I'm hopeful that this training will provide some foundational knowledge, and then once people get a year of experience under their belt, they'll be eligible to become certified navigators, which will help advance some of that standardization and have that external stamp of approval for those who are entering the field or have been practicing for a little bit.
It does sound we're about at the end of a Wild West for non-clinical folks, because you talk about certification, so it sounds like you're establishing this in part because you want to start developing some kind of consistency. Again, I'm using religious terms here, lay, caregivers, people not from the healthcare system, involved in the healthcare system.
Sure.
They're there, but there isn't this kind of universal agreement on how they should be trained or beyond.
Exactly, and you had asked before who could access the training. So I think, a caregiver who's very involved with someone in their family and helping them with their care, they might well benefit from the training but not care about certification. That's totally fine. It's good content. For those who've made a career out of this, who are professional navigators, and I try to differentiate, it's a bit of a mouthful, but I try to differentiate by saying non-clinically licensed navigator as opposed to lay, because these are professionals and they are getting trained and they have an important role in the system. We're hoping, yes, that it will help standardize the scope of practice a bit, can reaffirm some of those roles, and really promote team-based care and the roles of every member on the team. I think that historically, over the last 5 to 10 years, we've had debates about, okay, well, is navigation valuable? Does it do what, does it deliver on its promise? And I think that how do you start to measure that unless you know the basics of what these people are doing, right? If you don't have an agreed upon scope and you don't have some foundational similarity in what you know, then you could have a fantastic navigator because of their personality and their resourcefulness, and then someone else may be in a very different role being asked to do potentially inappropriate things in another setting. So.
And how widespread are patient navigators right now? And to what degree, you mentioned nurse navigators, and we're talking about non-clinical navigators. On the non-clinical side, how widespread are they?
So I can't really give you a number. I can tell you that my team also worked to submit a request to the Office of Management and Budget for a standard occupation classification code last year, and that was largely to try to be able to answer that question.
Gotcha.
So it's a registry of occupations and provides codes for occupations so that you have a sense of how many people, in what ways are they engaging in this profession. So I will tell you that for the Academy of Oncology Nurse and Patient Navigators, there's about 4,000 members, and I know there's about 1,400 Commission on Cancer accredited institutions, and as of this year, patient navigation, at least a process, if not an individual, is required. So I would say, estimating in the thousands. I don't know how many of those are nurses versus non-nurses. I do think there's an important role for patient navigators, social workers, and nurses, and that they can really complement each other very well. I think there's a lot of mental health concerns and social workers need to be really promoted in the cancer care system. I think that there's a strong role for nurse coordination as care becomes more and more complicated, and that there's a key role for those who don't have a clinical license to be able to help navigate people to insurance options and help them with arranging childcare, transportation, directing them to appropriate resources, engaging with community resources, which we have some amazing advocacy and support organizations that are available. So yeah, I would say in the thousands, but I can't really break it down further.
And to circle back, you talked about, you create credentialing to set expectations. Ideally, what should be the expectation for a non-clinical caregiver as far as role? in a health system?
Sure. Well, I think that it's appropriate for a non-clinical navigator to do anything that doesn't involve mental health counseling, clinical education, things that you're specifically trained to do. So if a patient is in high distress, if they want to understand their treatment options, then I don't think it's appropriate for a navigator to be doing those things. I do think it's very appropriate for them to help them understand what are their insurance options, what does their bill mean, how are they going to pay for things, do they need to look for a copay program, a copay assistance program, is there financial aid available to them, how are they going to manage their child care while they go to treatment, who's going to drive them to and from treatment, and helping to think about those questions to really prepare them to use the time of their doctor the most effectively and use those clinical professionals as we have a reduced workforce and a growing number of patients, really use that time wisely and leverage every member of the team.
I mean, in the end, sometimes it comes down to dollars and cents in the end for patient navigators. You know, in your research and, you know, in your estimation, just in your knowledge, how can a patient navigator save money or make a health system more efficient?
Right, so I'm glad you asked that. My team is actually involved right now with a study. We're looking at the value of patient navigation. And the approach that we've taken is really to talk to a lot of different people. So we are talking to navigators, we're talking to hospital administrators, cancer program administrators, some insurance plan representatives, and trying to get at that answer. How is navigation valuable? I can tell you from the literature and anecdotally that it is valued as a profession by patients in terms of assisting with financial aid and copays, by clinicians, by reducing no-shows. I think for administrators and bottom line folks, that's also important. If you can reduce no-shows, that saves money. If you can reduce hospital readmissions or ER visits, that saves money. If you can make sure referrals are correct so that people don't have to come back, then that, you know, is an appointment slot filled. So I do think there's a lot of potential to measure actual dollars and cents for the role. I don't think that we are quite there because we haven't had standardized measures. We haven't even had standardized roles. But what our goal is to create a streamlined core measure tool so that we can roll that out. People can start to collect similar information, and you know, maybe it is cost neutral, or maybe it's not making money because it's not a billable service, but maybe it's promoting the quality measures that are required to get paid as we move toward more value-based care. And so, you know, those things matter too. And I think there's a lot of potential that it could show indirect cost savings and downstream revenue. We just don't know that yet because we haven't been able to gather that information. So.
I'll play the cynical tech head, right? I'm going to pretend I'm from Silicon Valley here for a moment. I'm from Cleveland, but I mean, our patient navigator is essentially kind of a pit stop until we just get better tech. I mean, until Watson can talk to us more effectively. We hear conversations that sometimes people are more comfortable sharing things with a computer than they are with a human, right? We hear about text messaging. Obviously, the tech isn't perfected. Is simply a patient navigator that? We have to have humans here because we just haven't gotten a better, streamlined, more effective way to leverage technology to do these tools.
I don't think that I wouldn't put technology as the counterpoint to navigation. I think that there's a critical role for technology, and there's an important role for navigation. I do think that there's lots of scenarios. If we had fewer patients, if we had a more efficient healthcare system, if technology did talk to each other, and we had a higher health literacy in this country, more of a wellness focus, perhaps the role of the navigator would be less critical. I still think that there are some patients that really need to have someone as a point of contact. I mean, it's very easy to get lost in the system even when you aren't battling something that's a serious diagnosis. So are they important? I think absolutely. Are they absolutely essential? Well, if we fixed other things in the healthcare system, maybe not for everyone, but certainly for some people. And I think we need to be responsive to what patients prefer and how they want to interact, how they want to get information, and how they want to be helped through the healthcare system. Support groups are another example. Sometimes they're fantastic for people, other people it's not their thing. They would rather, they have an adequate support network with friends and family, or it's just not for them. And so just because something's not for everyone doesn't mean it doesn't fulfill a really important role for others that are going through the healthcare system.
It would also seem to be hard for people to really drive ROI on navigators, because it's, at least the way I've always understood it, navigators are largely paid for grants. They're not necessarily part of a permanent part of a budget for a lot of health systems. It would seem that if people would actually try to carve out a line item for them, there probably would be more focus on, all right, how do we make these most effective?
Yes, right. So as long as things are grant funded, it's easy to say, good job, you got the grant, and let's keep rolling, right? And as soon as it becomes operational and it becomes part of a departmental or operational budget, then yes, you are paying more attention to those things, and people are probably more interested in showing your value, showing the data. So I think it's not necessarily a horrible thing for grant funding to shift at some point. I don't think we're there yet, and I would hate for it to go away right now.
Sure.
But I am hoping in the future, once we have this tool developed through our value study, to try to start assessing some grant-funded programs and help to bridge that gap so that we can make a case for institutions on the value of the role before grantors start shifting their funding elsewhere.
So if obviously, we're still some steps away from a reimbursement on patient navigators, but it sounds like your research and studies are showing that could be a real possibility. If United Health walked up to you right now and said, all right, we'll reimburse for patient navigators, what should we reimburse on? What would you advise them to do? Like, how would you reimburse? What would a patient navigator have to do to get that reimbursement for a health system?
Sure. So I tend, at least at this point, my mind is, I'm of the mind that I would not like to see navigation as a billing code.
Okay.
I think that sometimes has potential to remove the service from those who need it the most. So let's say some health plans covered navigation and some didn't. Some of those people who needed navigation the most may not get the service, which I think would be problematic. I would be more of the mind to encourage payers to think about what quality standards do they want for oncology practices to embrace, demonstrating care coordination, demonstrating that patients understand their treatment, are adhering to treatment, or at least asking them if they choose not to continue with treatment, what those reasons are. So really looking at what's the function of the navigation role and how is that wrapped into all of the oncology services provided as part of the payment for overall care. I would just really hate to see navigation kind of segmented for those who have the highest tier health plan rather than those who may need the most
That's a really
help.
good point. That's a really great point. We have a few people who are watching. You're welcome to shout out questions that I can answer. But I also want to ask you, is there anything else you want to add? Is there anything we haven't covered in patient navigators that this healthcare innovation community should keep in mind?
I think you covered all of the big things in terms of value and the role. I think my only kind of pitch to folks would be to collaborate. I think we have a lot to do in the technology space. I think we have a lot to do in the engagement space. And one of the reasons that I love what I do every day and love the career that I'm in is that I feel like it draws very caring people that want to solve problems, and that this is an opportunity as we try to figure out these value-based kinds of models to really work together to make things better for patients, because at the end of the day, we all are a patient at some point, right?
You're right, absolutely. Well, for Mandi, Pratt, Chapman, I'm Seper. We're here at MedCity ENGAGE. Thank you very much for watching, and thank you very much. Take care.